My name is Nichola Bomani Gonzalez. I'm currently a third year OBGYN resident at Lehigh Valley Health Network in Allentown, Pennsylvania. Growing up, I was always really interested in science and math, so I knew I would do something in STEM. As a student at Science and Medicine, I was able to take some post-secondary classes at Cleveland State to get some of those calculus requirements and those things out of the way. So I was kind of gearing up for a STEM profession, but I started volunteering at a hospital, Fairview Hospital, kind of seeing how the hospital functioned, meeting people, learning more about their jobs. I think I learned that I was more of a social person. So instead of pursuing engineering, I kind of switched gears to medicine. I knew that a private school wasn't going to be an option financially for my parents, but I still wanted to have the best shot that I could to reach these goals. I think had I gone to a more traditional high school that didn't have that science focus, that kind of didn't hand select the resources that would be at the school and the programs, I don't know that I would have made it through the funnel. To be able to have all of these experiences in Cleveland at a public school. It was a really special experience to be able to have access to all of this stuff that in no other setting would you have access to. The opportunities that were available at Science and Medicine, I think were paramount in me making that pivot to medicine. So there were two summer programs that I was able to participate in. One was after freshman year. There was a zebrafish research project, and we worked in an ENT lab with zebrafish to learn more about their systems of perception and how they can apply to our own hair cells in our ears that help us with position and balance. And then in between my junior and senior years, I was able to do a cardiovascular research project along with three of my classmates. So we were all in the same lab group over at Case in the medical school. Had I not had that exposure in high school, I don't know kind of what career I would be in now. So that kind of early exposure to internships and mentorship was so pivotal for me. When you're coming from the inner city of Cleveland, coming from communities where a lot of people aren't doing the things that you want to see yourself doing, making it that much more accessible. So the fact that Case Western is across the street, we were able to take a tour of Case as high school freshmen. This is a top tier university that is across the street from you, and many of us didn't even know that Case Western existed. I think kind of making it accessible is just really important because you wouldn't even know how to enter those spaces or those systems. So it kind of was a warm introduction. The Cleveland School of Science and Medicine has done an excellent job over the years of fostering this community and culture for students that are interested in STEM, and providing all of these external resources that have been pivotal even to this day for our success. It cannot be understated how dedicated the teachers are to the students, to that culture, to that environment. They invested so much of their time over the 4 years. I still think about the lessons that they taught me, and the stories that they shared with me. But kind of seeing those faces every day, those people that are rooting for you, asking you about your college applications, asking you about your internship, telling you about internships, having that information and those resources concentrated is so pivotal because it's really hard to access these things if you don't have somebody that's looking out for you. I think I am so fearful of what would happen if that school, that community were to be dissolved. I think that these students like myself who maybe were the high achievers in their smaller public school, if you get put in this huge environment that doesn't have that same focus, if you don't have the individualized attention or just teachers that are aware of or have had experience with these internships and other things. Like maybe who's to say, what if I didn't do these internships or didn't have teachers? You can tell me you can take college classes as a high school student. Like, would I have learned Spanish? Would I have known that I can be a researcher and be a doctor? It's just so much of what I am doing now is a product of experiences that I had in high school, like early exposure. But I just speak so highly of it because was really set us up for a very strong college and medical school career. And I have many classmates who were not Edward scholars who ultimately made it to medicine that are medical school and residency because of these shared experiences that I mentioned. And many of us were coming from schools where we were, even though we were performing at grade level, are years behind where a peer high school would be. Many of them have had experiences, exposures, have traveled, have had so many experiences that are not accessible to the average kid from Cleveland. It's very accelerated, so much science, all of this stuff up front. I feel like it helped to bridge that gap that many of us had. So I think that like science and medicine has to stay around and we really have to kind of rally around it because I don't know, would I have made it through the system had I not met all these people and become an Everett scholar and have all of the support from the beginning of the pipeline to the end? Like who's to say? But I could definitely say it's made it easier. It's made it a more connected experience that I can like speak to you about and speak to other people about because I've been conscious as it's happening and not just with my head down. Like it kind of forces you to reach up and to reach back and to just share out because we want more people to enter medicine. There are definitely lots of doctors and nurses with interest there, but some people wanted to be educators. Some people wanted to be musicians, wanted to be like engineers or kind of research scientists. So somewhat in the STEM field, but maybe not like face to face computer science. And there were a lot of programs that our teachers like introduced us to try to kind of fosters those interests. So there was one such program called CLIVS that was also at Case Western in the Polymer Science Department. So those students could learn more about like molecules and chemical engineering. And that was a program over some years too. So kind of continuity, physically being on Case's campus, that kind of stuff really helps your mindset. And we had a lot of clubs at the school too. Like some people were into chess and cheerleading, had all the sports and everything. So there's like normal high school stuff. I was a volleyball player for all 4 years. I was a varsity captain. And then I played softball as well. Even though there's all this robust, science curriculum, you still have like, you can have a normal high school experience. You just study really hard. I have two sisters who ended up pursuing medicine as well. So when I was in high school, my sister, my middle sister was in college, and I saw how initially she wanted to pursue nursing, decided later to pursue medicine, and was really discouraged from that. You're not going to be able to do it. You're not going to, like, you don't have the support or the kind of the network to make this happen. So kind of seeing how my sister and she's successful in family medicine now, but she had a very rocky journey into that position. Whereas with this program, with this pathway, I had a very clear understanding of kind of what the next steps would be. And there was someone ahead of me in the path from high school to kind of know what the next steps were. So I think it was a really good setup for sure. From the moment I heard about it as a freshman, it's like, I want to get that scholarship. I want that to be me. So all these kind of experiences that happen in the first 3 years, but you applied early action to Case Western. And then from there, you were invited for an interview. My interview, it was the President's Day interview day. I'm like shaking in my chair, nervous. Oh my goodness. But I feel like during the interview, I just spoke from the heart. Like, this is who I am, and these are my interests. And I want to take care of our community. I want to take care of women and infants and just some of the most marginalized people in our community. Then this is me. Take it or leave it. When I learned that I was awarded the scholarship, they had overnighted the FedEx envelope. I'm like, this could only be one thing. And I was in the kitchen with my parents and my sisters, and I just like fell to the floor sobbing, like, oh my God. And it was just so exciting and affirming, and it's life changing. It's like a pipeline. When you receive the scholarship, there's somebody that's in front of you that, is already in college, and then somebody ahead of that person. So kind of by the time I entered Case, Nichelle, who was the first Edward Scholar, was about to graduate. And then she started medical school. But then when I got to medical school, she was already finished with her residency, essentially. So it was really nice to see that kind of progression. Like, what's next? Tell me about the step exams. Like, I had somebody to talk to you about those things. The journey to medicine can be isolating, especially as a kid from Cleveland. There's not many people who are on the ground running with you and have that same laser focus, and for many circumstances out of many people's control. So to have our kind of safe cohort has been so helpful. Jessica and Lily, who were a few years my junior, at times we would like go for bike rides, go out to dinner, and just kind of have time and space to just spend time with each other and talk about, oh man, this biology class and my step exam. And I mean, these are, say, everyday conversations or normal struggles for our classmates, but it's stuff that's like so foreign to us and that we've never dealt with before. And kind of from like an academic standpoint, just having a person who's been through these same rotations, who's met with these same professors and physicians while you're rotating and can give you some advice on how to navigate certain things is really helpful. Because there are many people who are in medical school that have been primed for this for their whole lives, and they've had these tutors and all these resources, which were things that we didn't have access to. So we're really tapping into our community as Joan C scholars. We're kind of making a network for ourselves and passing down all that knowledge down the pipeline and hopefully to the rest of the community as well. Yeah, I think access seems to be like a big theme. Like theoretically, could any kid from Cleveland make it to a good university and then kind of take the MCAT, do all the medical school requirements and make it through medical school? Like for sure, but just to have access to all of the support to help you through each step, to know what those next steps look like for the next 5 to 10 years. Like we've had something like 10 Joan C. scholars at this point. So you can see someone who's an attending, who's in residency, who's a medical student, who's an undergrad, someone who is like just finishing high school. Like you can see that modeled for you the entire way through. I matched into obstetrics and gynecology. So I'm an OBGYN physician and I love it. I take care of reproductive age women, I take care of menopausal women. I see patients through their pregnancy, through their labor, through their delivery. And then from a gynecology standpoint, I see women for their annual exams. I do surgeries, I do C-sections, I do hysterectomies, I do hysteroscopies, like anything related to the female pelvic organs is my expertise. I love that. I think female bodies are fascinating. Pregnancy is fascinating. And I get to have fun at work every single day. So within OBGYN, I'm planning to pursue a fellowship in maternal fetal medicine, which is our kind of high risk pregnancy specialty. So these are physicians who are managing twin pregnancies. If patients have chronic medical conditions and they do get pregnant, such as like chronic hypertension, high blood pressure, or epilepsy if someone has seizures, chronic kidney disease, what if someone needs dialysis or has cancer during a pregnancy? So those are the type of kind of clinical questions that I would be asked in the future. And also lots of ultrasound. So they're the physicians who interpret ultrasounds in pregnancy. Like I can tell you if your baby's a boy or a girl, but I can also look at like the kidneys to see if there's any signs of dilation or maybe this baby may have some sort of cardiac defect or may have a different anomaly that we're seeing, and just having the chance to sit down with patients, talk to them about what we're seeing and kind of counsel them on next steps and the surveillance plan in the pregnancy do. It's crazy to think that is an option for me in the near future. I'm going to be applying in the spring. Something that was touched on in our curriculum at Science and Medicine was healthcare disparities. Living in Cleveland is this huge medical city. Our high school is in between these two, like the VA's down the street, Cleveland Clinic is across the street, UH is across the street. Like, how are we in the epicenter of healthcare and the people that live in the surrounding community do not have access to the same healthcare as these facilities are reporting? So learning about Black maternal and infant mortality in our own city as a student was something that kind of lit a fire under me. Like, how is it possible that a Black woman is 3 to 4 times more likely to die in the peripartum period? It's just say unconscionable. Like, how is this even a thing? So I feel like hearing these statistics in my teens and seeing some of this stuff play out in real life with family members, friends, and friends, family members. It's like, I want to do something about this. Also, reproductive health is under attack everywhere for different reasons. So I wanted to be someone who could advocate for my patients, obviously in the room with them, providing the best care that they can get, give them the information and the resources that they need, but also to try to do something on a bigger scale to make these changes and to help kind of move the ball forward. One thing that really excites me about OBGYN and specifically maternal fetal medicine, it almost feels like preventive care in a way. My initial interest in medicine in medical school, I thought I was going to do family medicine because I love taking care of everybody and I can take care of the whole family. But starting to realize how managing blood pressure appropriately, diabetes appropriately, optimizing someone's thyroid or optimizing their seizure medicines, if while the patient is pregnant, you can do these interventions, it may prevent some of these outcomes, at least from a medical standpoint, that are happening down the line. And anecdotally, there's a difference when I know this as a patient, and I know my patients know this for me. When the person taking care of me looks like me, talks like me, and I see myself in them, it is a completely different experience. So I hope that let's say me existing, me being like the warm and bubbly person that I am, like I hope that's making some, even if it's a micro impact on one patient, I'm hopeful for that and what that could mean for that patient and her family. Yeah. Yeah. There's so many unspoken, or not to say don't need to be spoken truths. Like you could take care of the same exact patient, the patient could tell you the same exact thing, but those really subtle cultural cues or subcontext that may be missed just from tone or gestures, it just makes it so much easier. I'd say to communicate, like when you feel that I know this person will understand me. I definitely have a better understanding of maybe why someone would avoid seeking healthcare treatment or their kind of familial remedies and things like that. My father is Black American. He's from Paterson, New Jersey. My mom is from Guyana in South America. So I kind of grew up with this Black culture, Caribbean culture, and so many different family remedies and stories. If you have an asthma attack, you need to boil some garlic and all these sorts of things. So I get that times as a doctor, like, ooh, should I this? Should I just have some tea? Like, no, I'm going to make an appointment. I also majored in Spanish at Case Western. So I'm fluent in Spanish. And for those patients who maybe, especially postmenopausal women, if they have sexual health concerns, like they may not want to disclose those things if they have a male interpreter. Like they're not going to fully tell me about what their symptoms are, what they're experiencing. As a Spanish speaker, I'm literally able to hear from the patient directly and not need that intermediary that may kind of affect what they're comfortable saying. I'm grateful for the experiences that I had in undergrad, and Case Western, our medical school, has a great patient care curriculum to learn how to really sit down and talk to a patient, how to elicit their concerns. Like, we know you're empathic people, but what phrases can you use to better convey that? And I think those skills have been really paramount into me being a good clinician. Definitely. And it came up in ways that I wasn't expecting. I recall we had a seminar about genetic testing. So, do you want to get cancer genetic testing for BRCA or Lynch, all of these mutations that are associated with familial cancers? And for several of these conditions that are related to like the pelvic organs, at times it's recommended to kind of completely remove your pelvic organs if you're done with childbearing. So we had a case study. We're like sitting down at the table. One of the members in my group was like, and the patient's a Black woman. Well, it's really obvious here. She should just have her uterus and her ovaries out. And kind of the whole group was like, aye, and kind of moved on. And I was like, well, some patients really value their organs and they don't want them taken out. Is there another alternative? Or were you certain that that patient was done with childbearing, even though she's like 35 or 36? Like maybe she has a new partner, or maybe there's other factors at play. Like someone doesn't just decide to get a hysterectomy. Also, in this country where there's a history of sterilization without people's consent, like Giuseppe appendectomies and a lot of forced sterilizations in Puerto Rico, like there's also a lot of historical kind of context there. And, my classmate was just like, whoa, like, thank you so much. I honestly didn't think about those things, but these are experiences and stories and historical facts that for me as a Black woman are playing through my head, let's say every day. But how can I take care of this patient who I know has the same fears as me in the setting of all of this stuff? Like, how can I connect with you on an individual level. And I'm already aware of all of these things happening that may be anxiety provoking or, fear inducing, and they're real. When I was a student at Science and Medicine and I took those post-secondary classes, I enrolled in Spanish, was actually the first class that I took because at the time it wasn't something that was offered. We at Science and Medicine, you can take Latin or Greek, which I feel like is great for the sciences and learning root words, but I need to talk to people. So I took like Spanish 102, and then kind of slowly progressed. Like I took a Spanish class pretty much every semester in high school. And then by the time I had graduated high school, I was at like 300 level for Spanish. And I was able to transfer those credits to case when I started. So full disclosure, I double majored in biochemistry and Spanish because I had some mentors who felt very strongly about you should have a STEM degree. So I do have that knowledge base, but the Spanish was my passion. And I think studying the humanities really changes you. Like thinking about grammar, word structure. I also had the opportunity to take Portuguese and Arabic. I love communication and just learning how people communicate things differently. You're conveying a meaning and the words that you use or how that comes across is different. I had classmates in college that were English majors, that were history majors. My best friend from undergrad was a religious studies major, and she also went to Case Western for medical school with me. And the people who majored in political science and history, when we had discussions about ethics and family structure, who was making the decisions, these are things that a lot of medicine revolves around too. Obviously, you're going to learn how to be a good doctor, but some of those experiences early on just change the way that you view things. So I presented my research at the SMFM conference last year. That's like the kind of big meeting for our specialty, and that was in Denver. And then in April this year, I actually was invited to Austria to present my research about ICD, these like defibrillator devices in women in pregnancy. There are not many patients that have those devices in pregnancy, so I got to present that research in front of other maternal fetal medicine specialists, radiologists, anesthesia colleagues, and it was really cool. I'm so excited to see what the future holds from that standpoint. I'm really excited for this profession, for this subspecialty. I think the future is bright.